All right, folks, I'm Don Ford. This is Brace for Impact, brought to you by Organizing for Better Tomorrow. We're coming in a little late than usual, as in 2 weeks late, right, Terry? This is the longest break we've been
Little
taking.
hiatus was longer. Yeah, it
Yeah,
is.
but I want to talk about this mRNA boosting cancer responses study. And I really want people to understand that, A, all of the interpretations you saw on the internet of it are not material that was in the study. First off, number one, all these people wrote these big ass pieces. The study is like 20 sentences. They haven't released the full study. They did give a presentation. They basically studied from 2019 until 2023 specific cancer patient outcomes of people who in Texas and Florida only, and this is
That should raise a red flag right there.
right. Like, why are they pulling data only from the states with the most COVID and the least protection efforts? So this is where you're going to find the most people who don't protect themselves from COVID at all. So when you get a COVID vaccine, and this is something we've talked about a lot, that usually coincides with other protective measures. When you're on cancer therapy, anything you take as a protection measure is going to increase your survivability rate. And I think it's also very important that the claim that they're making now this is true, but it's from a mice model. When they were injected with it, it increased interferon type 1 or type 1 interferon. I wrote about last year, or like early this year, I released it, but I wrote it last year, where I had this big explanation where I wrote about the immune system, explaining how it all works. And I explained that interferon type 1 is closely aligned with improved cancer results. So, like, people who had more interferon 1 did better with cancer. Just a thing that happened. Their claim is that if you got an mRNA vaccine within 100 days of getting ICI treatment, so you're starting your immunotherapy, that it would prime CD8 T cells to align with, I can't remember what they're exactly called, but they're cells that are on the surface of the cancer. It's another, TLR4, whatever, I can't remember what it is exactly. That aligned with the cancer cells, and that allowed the cancer to get removed theoretically. But the thing is the study didn't show tumor clearance. The study showed survivability. So, and in their survivability, the increase in survivability was like the difference between like 33 and like 55%. So it didn't like lead to this overwhelmingly increase in survivability, but rather it left to increase marginally for people who took more protections, were more likely to survive for longer. Yeah,
And
it's
then
shown.
how many drugs have been very successful in treating things in mouse models, and we're very excited thinking we've got a cure for cancer or a cure for whatever, and they don't work at all in humans because our immune systems are quite different.
Yeah, there are similarities in our basic approach to antibodies, but it gets like our immune system is so much more complicated. And if anything, this requires more data. Now, there might be something here. Interferon 1 does help with cancer. We know that. And we know that vaccines boost interferon 1 because it works just like an infection, specifically with mRNA. But guess which vaccine boosts interferon 1 and 2 better? Better of the vaccines available. It's
Starts with an N. It's right on the tip of my tongue. Novavax.
That's right. Well, we got
Um,
something coming up for this. It's called ICER. They basically are going to be going through a year-long process to economically and whatnot figure out which is the preferred or better COVID vaccine. So they're talking about going through all the data, and it is going to be a multi-month process. It starts next month on the 10th. So we're going to be starting a public comment drive for that on the 10th, trying to express the differences in the data. But this is a group that normally works on therapeutics and measures therapeutic things, and they want to switch over to measuring vaccines. And I think that this mRNA helping with cancer study and the way it's written coming out the way it is, and it feels very rushed, is a big red flag that they're planning on trying to sell mRNA as a therapeutic, which again, Novavax is a better therapeutic when it comes to helping people with long COVID, helping people with other persistent virus issues. We explain that Novavax operates as a therapeutic in some capacities for some people. And I feel like the mRNA people really want to come in and sell this as, well, if you get mRNA, it proves that you'll have greater cancer survivability rates. But that's actually not what the study proved. The study proved that people do live a little longer with behavior associated with this. And there is some argument that interferon 1 helps with cancer, but I mean, yeah, water is wet too.
There are mRNA treatments that are being explored for some major cancers like glioblastoma and pancreatic cancer, and they're having some success using an mRNA technology, but not COVID vaccines.
Yeah, so in this capacity, just so that everyone's on the same page, this is strictly about COVID vaccines. This is not about the potential for mRNA as a therapeutic, because I think overall, if we want to look at mRNA versus Novavax's platform, I think there's no question in my mind that mRNA has greater therapeutic capabilities overall, because there's way more that it can do. But I think Novavax has greater prevention capabilities, and that's what we're doing with this conversation. In this context, we're trying to prevent COVID, we're trying to prevent long COVID, we're trying to deal with persistent virus. So these things really go hand in hand. Then people, they want to say they don't, and you're just like, nah, that's bad science. That's bad science.